Thank you so much. My name is Mayoka Jole, and I'm a dentist at Yeko Dental Medical Center, Masaka. Today we are going to talk about complication of tooth extraction. Very many of you go to a dental clinic, they remove your tooth, and afterwards you encounter pain on that wound. Some of you go to the dental clinic, you say that the dentist has left a tooth, remains a root in the socket, and you encounter pain, yet he has removed the whole tooth. So we are going to talk about that complication. In another term, it's called a dry socket. What is a dry socket? When the blood fails to, when the clot fails to form after tooth extraction, in the between 2 to 3 days, that is a tooth. That is a dry socket. So how do you know that I have a dry socket? One, you have acute pulsating or throbbing continuous pain. Acute pulsating or throbbing continuous pain. Most especially that wound is very painful. Sometimes it's even more. Is more than a toothache. So you get that pulsating, acute pulsating pain, because after extraction. This one, it occurs between 2 to 3 days. It may also reveal a socket filled with debris. When you try to look at that socket where the tooth has been removed, you are going to see some debris into that socket. Another thing is the surrounding mucosa may also appear inflamed, swelling. The surrounding mucosa, I mean the gum where the tooth has been removed. That surrounding part, it may also look inflamed, swelling of that part. There is also tenderness of the adjacent teeth. The nearby teeth are tender. For example, when you percuss on them, you may feel some pain, because that pain is brought by the other wound which has failed to heal. There is also halitosis. When you talk about halitosis, that is, in another term, is called bad breath. You may feel that bad breath after tooth extraction. I said earlier on that this one, it occurs between 2 to 3 days after tooth extraction. There is swelling of the lymph nodes, especially if it's a dry socket occurs mainly on maxilla, on the lower jaw. This one is, this part of the maxilla is less supplied by blood. So there is we talked about swelling of the lymph nodes. We talked about systemic response in front of the fever. Sometimes you get that fever. The blood, the temperature tend to raise. The temperature tend to raise. So that's how you can indicate that I have a dry socket, especially immediately after tooth extraction. So if you have got such kind of clinical signs, now the reason is, what causes dry socket? What causes dry socket? One, excessive trauma may come in due to difficult extraction. If the extraction procedure has been very difficult, the surrounding area has been traumatized, damaged, you may end up getting that dry socket. Then impaired blood supply. If the area where they have removed the tooth is not supplied by enough blood, you may end up getting a dry socket. Another reason why, another cause is local anesthesia. Sometimes the drug we use in to the drug we use to numb the area where we are going to remove the tooth, it may cause the dry socket. Reason is it constricts the peripheral blood vessels. Once it constricts the blood vessels around that area, it means that clotting may be very poor. Then we talked about radiotherapy. Radiotherapy. You know that when the radiation are directed on that area where the tooth has been removed, remember very well that the radiation kills the what? The blood cells. Once the blood cells are killed, are damaged, clotting is going to be very poor, hindering wound healing. Then we have also immune suppressed patient. Immune suppressed patient, we talk about people with HIV. People with HIV, people with diabetic, people who are hypertensive. Remember very well that those people having their immunity is highly suppressed. So healing or blood clotting is going to be very poor, resulting to poor wound healing. We also have cigarette smoking. People are smoking. You know very well that when you smoke, blood clotting is hindered or is limited. Sometimes the area where that tooth has been removed, blood clotting is going to be affected, resulting into poor wound healing, leading to a dry socket. Failure of the patient to follow the post-operative instructions. Some people, when we remove a tooth, we tell you that don't touch there, don't use a straw. Those precautions we always give, especially when after extraction. Some people, they don't follow them. Once you don't follow them, you are likely to get a dry socket. So, how do we manage the dry socket? It's another important thing we need to know. How do we manage the dry socket? So if you encounter the other signs we talked about, throbbing pain, swelling of the mucosa, we talked about fever, some increased body temperature, especially after tooth extraction. When you encounter such kind of signs, what are you supposed to do? What are you supposed to do? One, if you are at home, we encourage patients to go back to where they have removed their teeth from, or to a dental clinic. When you go there, the dentist will manage the problem. The dentist will manage the problem. If you can't access the dentist immediately, we encourage to keep on rinsing with warm water plus salt. You have to keep that wound very clean. So we encourage you to rinse with warm water plus salt, so that the other area or the other debris can be, when you rinse, the debris which is in the socket can be moved. But we encourage the patient to go to the dentist, to go back to the dental clinic. They manage that wound. There is a way we manage that wound. There is a way we manage that wound. We clean that wound, we initiate the bleeding, and we make the wound fresh again, so that healing may occur. If not, you can follow us. You can call us on our numbers, which are following, which are below there. You can also for more information, you can subscribe on our YouTube channel, Ask a Dentist. You can follow us. You can follow us on TikTok. You can follow us on Facebook. Thank you so much for listening. God bless you.